Good afternoon, ladies and gentlemen of the press. We have invited you here today to put across our roadmap of industrial actions resulting from the overly delayed implementation of our collective agreements. And it is our hope that you will carry this message to the general public about our frustration with regards to the lack of agency and commitment on the part of the employer to have our collective agreement implemented. The said collective agreement was signed in May 2024 between the Ghana Registered Nurses and Midwives Association, representing the entire nursing and midwifery fraternity in Ghana on one part, and the employer, represented by the Ministry of Health and its agencies, the Ministry of Finance, and the Fair Wages and Salaries Commission on the other. 1 year on, our collective agreement is still not implemented, although we recognize the fact that a section of our fraternity had taken the matter to court and delayed the implementation. Judgment was given by the court in January 2025, and we have followed up with letters and in-person visits to the Ministry of Finance and the Ministry of Health since then, but to no avail. We therefore wish to state as follows. 1, the delay is not only a disservice to Ghanaian nurses and midwives, but also poses a threat to the delivery of quality health services to the good people of Ghana. 2, nurses and midwives are the backbone of the healthcare system, and despite challenges we face in our various fields of practice, we have continuously shown unparalleled dedication and commitment to delivering quality care to our patients across the nation. Despite this unwavering dedication to service and patient ethos, failure of the employer to honor our collective agreement critically undermines the worth and appreciation of our services. In our view, we have exhibited extraordinary patience and professionalism over the last 5 months, ensuring that the health sector runs unimpeded while advocating for the implementation of our rightful entitlements. 4, at this point in time, Ghanaian nurses and midwives are tired of excuses that the leadership has been making on behalf of the employer, and leadership is equally tired of the excuses from the employer. 5, we are therefore setting out the following roadmap of industrial actions and call on every nurse and midwife in Ghana to follow it to the latter. 2nd and 3rd June 2025, wearing of red armbands or headbands in all health facilities across the country. 4th to 8th June 2025, withdrawal of outpatient department services, or what we normally call OPD services. 9th June 2025 onwards, withdrawal of all services. We are so committed to dialogue, but demand one thing and one thing only: implementation of our collective agreement. Thank you very much. Appropriately. And then Shemua, ya frere journalist for some umbrana mumeti ye asem baako ne yepese de tudwa. Eba no ye collective agreement eye enioma e wo se de wafa edwuma mu ye employer eye mayen no ye sign ye last year May 2024 ebesi ne ye employer emfa nye edwuma when we say, yeah, call for me be at the ensembly court, Emma implementation, no change, so kakra, but January 2025, court, no Emma judgment. Emma, from January up to date, your DHA at Ministry of Finance, Ministry of Health, say almost share, now almost implementing my. Sisi a baby a yedri nsem baako mienu bi ne epese yeka. Baako ne say collective agreement na your employer implementing ye no. Eya how kese ema nurses ne midwives o Ghana. Afei so the delayed implementation no a pose threat. Emma edwuma ayeye no ede magana phone na. Number 2. Eba ne nursing and midwifery a edwuma ayeye no edanson bebre. The baby a yehu bia yeye edwuma bia no ye wo how bebre. Enso ni na ekire no. Ya fa to yehu so say de bia ye be sorry. Ni akwa edwuma ni akwa ye de se na efata. Emma your patients any Ghanaians as a whole. When in nature no, your collective agreement kakra was a buying eshe, and now your employer eshe no implementing no. On shine ye, ne no my who say a bia mpo. Ye sooner ye buying a juma ye no, and so your employer nini. Ne a high and bebree. The eka atroso me and son say, ye nimpa say ye nya abotre kese. Esan say. Every May 2024, ebesi neno. Yenya abotre bebre. Ehwe nim say your employer be implement your collective agreement no. And so no, yenye hu eho asem ema na si. Afei so yen as leaders de bia ye the one excuse ye ka che members no oh montwen ochina ebeba ene eye budget reading ochina minister tukwan ochina eye say ya members no so ma bre nsama aye kan ni na no o ma tia bre si say yen so as leaders no excuses na de bia ye sorry e de koma ye members no yeso so no ya bre ene excuses a employer ne de mayin enti asama aye kan ne say 2nd and 3rd June 2025 yesre a nurse for ne a midwife for I wa Ghana fa na nyina say red band here bombing say omonso mbobi no mo fa nkwa adwuma wontumi fa mbo wonsa fa bo tri baby a de bebo ebe ye bia no fa bo na fa kwa adwuma na obi hu say ye ni abre ye ni bre no so e ade ba kope ye hwe say ye collective agreement no ye employer be implement it 4th to 8th June 2025 outpatient department services was sorry free ufia obetumi akọ OPD a nurse be show doctor be show sa service na nurse be show no wa take you vitals and now temperature o BP no we be say we no mo asem se de ne how no wa chiro no de wa kwakoma doctor no from 4th to 8th June ye say adwuma ne biom from 9th June 2025 ekono ye adwuma ye nyina no ye begyan ye nya biom efano ward adwuma theater adwuma ehemfa adwuma nini na ye begyan from 9th June 2025 enti no asam baako pe eni ye ka ye de ya ready say adwuma no ye bekoso aye ade a ye hia ne say ye collective agreement no ye employer na implementation so ye ade baako pe agreement no wo hodada enya afa ni eba be negotiate biom enti omo ntro krata nto so enfa nkoma Ministry of Health ni agency say your collective agreement is implemented omo santro enkonkoma controller and accountant general say your collective agreement no it is implemented eno an ye hwehwe na asomdwie emrefi eno ano no yedamo ase questions if any. Please go ahead. Thank you very much for the question. So we are not expecting the Fair Wages and Salaries Commission to review anything. When you look at what a collective agreement is, it is an agreement that the employer and the employees have signed onto. We represented our nurses and midwives in terms of the negotiation, and we did a diligent job as far as we could, and signed off the collective agreement in May 2025. So far as it is, that is May 2024. So far as the collective agreement is signed, it behoves on the employer to implement. So at this time, we are not expecting Fair Wages to open up any sort of negotiation or any review or anything. It doesn't fit into the process of the implementation of our collective agreement. We are only expecting the employer, and here the overall employer as government, to implement the collective agreement. Like we have done or we have seen in the past, it only befalls on the Ministry of Finance to write and inform controller that our collective agreement is implemented, so that all those monetary aspects can be implemented. The non-monetary aspects, the Ministry of Health and its agencies will also take it up and implement same at the various teaching hospitals, the Ghana Health Service facilities, and the CHAG institutions. So that is all that we are asking for. When it comes to the total number of nurses and midwives nationwide, we are talking about 125,000 nurses and midwives across all the agencies. And therefore, withdrawing our services, like we already know from the experience we had in 2020, has dire consequences for health service delivery. The work that we do, no other category of health professionals can do it for us. We know best how to do our job. And when we leave the work for even 24 hours, we know the implications. That is why we have had a lot of patience over time. But we are not seeing any commitment on the part of the employer. They are not taking our issues seriously. And when we are calling for implementation of collective agreements, and the stories we keep hearing is, we need time, we need a little bit more of time, we need briefing, we need somebody to tell us what it is that you are asking for. When the document is there, it is readily available. It has its contents. The category 2 and 3 allowances are there. Our core allowances are also there. I don't know what else anybody wants us to say. And like I said, our members are tired of the excuses we are giving them as leaders. We are not ready to put our heads on the table for the employer. We won't do that. And at this time, we are also tired of the excuses. They should come up and just tell us that tomorrow they are signing it off, and it will put a rest to everything. And that is what we want the public to understand. We are nurses and midwives. We know our responsibility. We know our call to duty, and we are ready to do it. But we cannot sit aloof when our collective agreement, which will motivate us to work, which will take us in terms of transporting us to work, which will take us in terms of feeding us, which will take us supporting our families, is not given. We cannot just sit back and allow it to happen. We are not the only public sector workers. We have seen other collective agreements being implemented within the last 5 months. We have seen them. So why is ours not being implemented? Is it that our worth is not appreciated by our employer? We know our worth. We know we are the hub around which the health system runs. And when our services are not there, nobody can do the work without us. We have set out a roadmap. We hope that the employer will take this seriously. We don't want to get to a point where we take away all our services to the detriment of the ordinary Ghanaian. Action should be now, and the action now is getting our collective agreement implemented. Thank you. We are all in Ghana here, and we know the efforts that the National Labour Commission makes and what it does. We are sending copies of these documents to them. At the end of the day, it takes the Ministry of Finance to get this implemented as quickly as possible. So at the end of this press briefing, we are sending copies to all our employers. When I talk about our employers, I'm referring to the Ministry of Health and its agencies. The agencies are the teaching hospitals, the Ghana Health Service, the CHAG institutions, and any other agency that we have nurses and midwives working. You mentioned the implementation or the implementing agency. In fact, it is not just the Ghana Health Service. The implementing agencies are all the agencies under the Ministry of Health. So the Ministry of Health, for example, takes care of nurse educators and those in the teaching field. If you talk about the Ghana Health Service, the teaching hospitals and the CHAG institutions, of course, they cover all the nurses and midwives that are working in those facilities. And of course, the Mental Health Authority, in terms of the psychiatric or mental health facilities or psychiatric hospitals that we have in the country. So these are the agencies, and that is where you find our nurses and midwives working. So it behoves on our mother ministry, which is the Ministry of Health, to also put some pressure on the Ministry of Finance to get our collective agreements implemented, because at the end of the day, it is the Ministry of Health and its agencies that will suffer, and not the Ministry of Finance. Of course, we don't expect Ghanaians to suffer for this. It is said that when the two elephants are fighting, it is the grass that suffers. The ordinary Ghanaian who is sitting out there shouldn't suffer for the inactions of the Ministry of Finance, and therefore we request that the Ministry of Finance does the needful, and that is getting a collective agreement implemented as soon as possible. Any other question? Any other question? I guess there are no other questions. So, committee, the National Council of the Association, and the entire nursing and midwifery fraternity in Ghana, we want to thank you very much for heeding to our call and being here. We hope that what we have communicated to you is exactly what will be communicated to the general public. We know our employers have ears on the ground. They will hear us. We are also sending copies of our statement to them, and we hope and pray that we will not get to the West, where we will draw all our services. Thank you very much for coming.